Are we checking a box on benefits or truly supporting our people? What if your caregiving and wellness benefits look great on paper, but they feel irrelevant in real life? Here's the reality. Many organizations proudly list flexible schedules, family leave, wellness credits, and employee assistance programs in their HR packets. But when employees actually need to use them, whether it's for caregiving, chronic illness, or personal crisis, they often find that the support is confusing, inaccessible, or risky to ask for. So the question isn't, do we offer benefits? It's, do our employees feel safe using them when it really counts? If we haven't met, I'm Dr. Anna Thomas. I'm a physician, leadership speaker, caregiver advocate, and corporate wellness specialist. I help organizations strengthen their workforce and create workplaces where people and performance can thrive together. Even as we enter an era of AI, automation, and agentic teams, the future of work is still human, and that work is changing dramatically. But at the same time, employees are navigating complex personal and professional pressures that are only going to escalate in the coming years. For example, in the next 5, 10, 15 years, we will see an exponential increase in the number of older adults who will need caregiving support. Who will be providing that care? Working adults. Right now, 63 million Americans are caregivers. That's 1 in 4 adults, with more than half of them currently working full-time. Those numbers are expected to increase and will have a tremendous impact on our communities and, yes, even our workplaces. And caregiving is just one example of a personal stressor that will impact the workplace. Mental health, chronic illness, stress, and burnout are all on the rise, and the organizations that will thrive are those that lead with care, culture, awareness, resources, and empowerment. Care. Through this series, I share practical strategies, leadership tools, and insights to help you create cultures that support well-being, strengthen engagement, and retain top talent. If you'd like a clear starting point, then check out my free training, The Future of Work is Care. The link is below. And while you're there, be sure to like, subscribe, and share this with another leader who is ready to build a workplace that cares. Let's get into today's topic. Let's talk about the gap between policy and perception. I've sat across from high-performing professionals whose careers were quietly unraveling, not because they lacked commitment, because they were managing caregiving or chronic illness or health challenges that they felt unsafe disclosing in the workplace. And I've also spoken with leaders who were stunned to learn that their well-intentioned benefit program wasn't being used or even trusted. Now, this isn't about blame, it's about alignment, because benefits that aren't believed in don't retain talent, they repel it. Let's talk about that invisible wall. It often looks like this. HR assumes that employees know what is available. Leaders assume managers will offer flexibility. Managers assume HR will handle it. And employees, they assume asking for help is risky. Even the most generous programs, extended leave, EAPs, flexible scheduling, they can fall flat if they're wrapped in complexity or stigma. I once worked with a company that offered excellent family leave, but required employees to drain all their PTO first, submit personal medical documents, get 3 levels of management approval. Technically, it's generous. Emotionally, it's exhausting. Practically, it was inaccessible because of all of the hoops that they had to jump through in order to get that family leave. So it sat virtually unused. And silence became the culture because it was felt that if I have to go through all of this, are they even going to give it to me? So let's go from checking the box to real support, to move from policy to practice. You don't need a longer list of perks, right? You need 3 things. You need trust, usability, and alignment. So trust. When your leaders, when your team members are talking openly about things like caregiving or illness and your personal life, they're telling the rest of the team that we support you. Use what you need. That's why we have these benefits, because we want every member of our team to be supported, to thrive. We'll back you in this. The second is usability. Employees should be able to access the benefits easily without confusing layers and layers of paperwork or hidden gatekeepers. And the third is alignment. We want leaders who are trained to respond with empathy and consistency, not discomfort, inconsistency, silence. That is the difference between a policy and a culture. So ask yourself these 3 questions. Do your employees know what benefits they can use without penalty? Do they know how to access it? Do managers model flexibility, or are they quietly, unconsciously discouraging it? Are your benefits designed for real life, not idealized circumstances? And does your workplace culture celebrate and encourage rest, or do they only reward endurance? If you're unsure, your benefits might be performing on paper, but failing in practice. Because a true measure of support isn't what is written in a handbook that no one is reading. It's how it feels in the moment that someone says, my dad's back in the hospital, or my child's therapy schedule changed. That moment is your real culture audit. So how do we close that gap? Simplify access. One clear hub, one point of contact, one process. Confusion makes it so much harder for anyone to access the resources. Train your leaders to be gateways, not guards. Give them the scripts and the confidence to say yes first, and then figure out the logistics. And share the story. So if you have employees who've used benefits successfully, normalize it, share it, don't stigmatize it. And review it annually. Check and see, are your benefits still meeting the needs of your current, evolving, multi-generational hybrid workforce? Do surveys on an annual basis to make sure that the benefits that you are offering align with the needs of the people on your team, and align it with purpose. Every benefit should tie back to one core idea, that we care about you, our team member, as a whole person, not just as a worker, and we want you to thrive and succeed. Because when you thrive and succeed, we thrive and succeed. And if you want a blueprint for how you can make this organizational change, then start with my free training, The Future of Work is Care. And if you haven't yet, check out my book, Workplaces That Care. It's your playbook for building resilient, human-centered organizations. Now, before you go, remember, if you have an employee who is quietly struggling while support is sitting unused, it's not an engagement problem. It may be a trust problem, and you can fix that. Because when people trust their workplace to support them, they stop hiding. They step up, they stay. That is a culture worth building. In the next video, we're going to talk about what small actions can empower employees to integrate caregiving and their careers successfully. While you're waiting, check out How Do I Balance Productivity and Compassion when Team Members are Caregivers. Remember, in this age of AI, the future of work is still human. So let's create workplaces that care together.